Hey everyone, how's it going today? My name is Zach Courier, and I am joined today by Dr. Madan Kandula. How you doing today, Doctor?
Doing great, doing great. How about yourself?
Doing really well. It's so nice of you to join us. You're in Milwaukee right now.
Yep.
You're part of Advent ENT, which you're a founder and CEO of. Since probably since founding it, I mean, it has absolutely exploded. You guys have 10 locations now in Wisconsin and Illinois. Tell us a little bit about your journey with Advent ENT, how you came to be an ENT doc and grow like you guys have.
Yeah. I mean, I think honestly, for me, becoming an ENT likely has a lot to do with the fact that I've dealt with a ton of ENT issues in my life. I broke my nose when I was 7.
Mm.
I've had allergy issues when I was a kid, been through allergy shots, broke my nose again when I was in college, went through a rhinoplasty, went through a septoplasty, and then eventually, after I became an ENT, went through another septoplasty, sinus surgery. I've been there, done that. And so I think for me, when I was going or decided to go into medical school and was trying to figure out what I was wanting to do, I think honestly it naturally kind of gravitated to wanting to understand more the issues that I was dealing with, and it's not the entire part of it. I mean, honestly, I think I honestly feel like ENT is the coolest area of medicine. We get
Mm.
to do the coolest procedures. We get to get great outcomes. We deal with folks who are having miserable quality of life issues and turn those things around. And
Right.
so there's just a lot of good things about it. But for me, I think it was my personal journey that led me down the road of becoming an ENT to begin with. And then I think, while it's separate, we started the practice in 2004. We've grown, over time, especially recently. But I think the sort of personal investment in the conditions that we are treating rings true and through, meaning that, for us, the reason I started this practice was I wanted to have a practice in the world where, for folks who were dealing with these issues, had a place to go. This is the place. And so that's what we intended to do back in 2004. And as we've grown, or what spurred our growth, is people coming in to see us from all over the place and sort of, basically begging me or making me answer the question, well, why aren't we in Chicago? Why aren't we in, Appleton up in Wisconsin? And so it sort of goes both ways. I think there's a definite passion about what we do and why we do it.
Absolutely. Talk to me a little bit about the psychology even behind, like, why do we, I don't know if it's a cultural thing as a society or whatever, but why do we live with these symptoms and these, painful things like snoring and sleep
Mhm.
apnea and this and that? And why do we put off going to see a professional like yourself for so long?
Yeah.
It's, yeah, I mean, even this year, right? Global pandemic, there's, that's another thing to think about. Oh, maybe I'll do it when that blows over. Why do people do that? And what's your advice, to people
Yeah.
suffering right now?
Yeah, unfortunately, I can go negative or positive, but on the negative front, I think part of the reason that people don't seek treatment is that the medical system that typically treats these issues is generally broken. And so, if you're dealing with a stuffy nose and it's really bothering you, and you go in to see, somebody in that typical medical model, you're likely not going to get an answer, and you're not going to get a solution. And I don't and I don't want to throw anybody under the bus. I don't mean to do that, but I guess I'd say for me and what we're doing, what we're trying to do here is flip it around and say there's so many people suffering needlessly. There's so many good options and solutions that we have and we can deliver. Why don't we, sort of reach our hand out to the patients and people out there who are suffering and say enough is enough? I think really the short answer to your question is if you're suffering with an issue and there's no apparent solution, then your only solution is to continue suffering, and that's not a good thing. And so I think part of our reason for being is to sort of say, like I just said, enough is enough. If you're snoring, if you're kicked to the couch, or your spouse is kicked to the couch, you're drooling on your pillow, all those things that nobody wants to do, and there's something you can do about it. And they're the good thing nowadays, there's so many good, easy options. It's almost, I mean, it almost becomes ridiculous when when you say what you just said, which is true. There's so many people suffering, and yet, sort of right over here, there's a basket full of solutions that we have. Like, we got to be able to connect the dots there, and that's what we're trying to do.
Absolutely. And I saw, reviewing your website and your accomplishments, you're the first in Wisconsin to do a balloon sinuplasty. Can you tell us a little bit of what, sinus and deviated septum surgeries you perform, kind of what you like to do, what those kind of entail? Can you kind of take us down that road and, who it affects?
Sure, absolutely. I mean, it really at the end of the day, whether it's a deviated septum or sinus issues, those are all anatomy issues. And so, just to kind of walk somebody through all those terms, septum is the dividing line in your nose, divides your right and left side of your nose. It's very common to have that be deviated, where it's not
Mhm.
straight, and so then your nose is blocked up. You can't breathe properly. So it's a very simple procedure that we can do nowadays to straighten the septum out. That's easy, and that makes a big difference. The sinuses are air pockets in your skull that all have openings into the nose. For many folks, those openings aren't big enough. And so we need to make those openings bigger. We could do that with traditional surgery called endoscopic sinus surgery, get somebody to sleep, look in the nose with a camera, make those openings bigger. That works really well. And there's a lot of folks where that's a really good option for. The good news is there's balloon sinuplasty, which has been around for a long time now. For about 15 years, we've been able to do open the sinus openings up with an angioplasty balloon. We can do that in the office. It's a very quick procedure, well tolerated. So if somebody's suffering, for instance, with headaches or sinus infections because their sinus openings are too small, our job is to understand that might be an issue, get the information to figure out, is this actually what we think it is, and then explain the options. And lo and behold, when we understand what's going on, understand what the options are, and you present the options, again, for folks who have sinus issues, for instance, there's surgical options where we can get you to sleep to do this. We can do it in the office with a balloon, a 5 or 10 minute procedure. Most folks tend to choose that office-based option, and that's a good thing. I mean, it's for us, it's really doing what's right for the patient. And the good news is, whether you go to surgery or we do it in the office, if an area is tight or shut down, and we make that area more open, whether it's your breathing passages or the sinus openings, that's a massive difference. So if somebody's suffering needlessly with kind of quality of life issues because of that, sort of simple anatomy problem, those are, again, it almost it gets me going, because it's so simple nowadays to provide solutions that there's just no reason for somebody not to seek out help, and there's just no reason to suffer through life anymore.
Yeah, for sure. And I saw, with some of your social media too, you guys address mouth breathing a
Mhm.
lot. And I think sometimes people just assume, oh yeah, I do more breathing through my mouth, I know I think about it when I go on a run,
Mhm.
it's like, all right, let's make sure and get the nose involved or whatever.
Yeah.
But you guys really address how not normal that is, right? How abnormal it is to breathe through your mouth, and how it kind of manifests other issues. Can you speak to that a little bit?
Yeah, absolutely. Yeah, but you shouldn't breathe through your mouth unless if you're sprinting and you're at the, you're completely winded. I'll give it to you. That's
I'm
fine.
not that
But
fast, so yeah,
yeah, you
yeah.
never know. But anyway, but short of that, if you're going through your day-to-day life, or you're sleeping, which is part of your day-to-day life, your mouth should not be hanging open in order for you to breathe. If
Mhm.
you need to do that, then there's a problem, and that problem is likely that your nose isn't working, your nose isn't open enough, and it's really common. And so I think the deal is. The reason why it's common is nobody has put their hands up and said, this is a problem and you should do something about it. And it's not just about the mouth breathing. It's the fact that, the nose is the start of your airway. And if your airway is broken and not working properly, that impacts everything about your life. It impacts everything that there is about you is negatively impacted if your airway is not working, or flip it around and positively impact if you can get it to work. And so for a lot of our folks, I'd say the large majority, if not almost all of our patients that we see and we treat, they don't know how bad they have it until we get them fixed and we get them breathing properly. And then they say, I didn't know this is what life is supposed to be like. And because there's really nothing to compare it to. I think the only patients that we tend to see that kind of they're sort of adamant, I got to do something, we got to do it now, is somebody whose nose is working okay, they break their nose or have some sort of trauma, and all of a sudden they're left with a nose that's suboptimal. They're miserable, they're mouth breathing, and they're wanting to get something done like tomorrow, kind of a thing, because they know what they're missing. But most of our patients don't have that kind of aha moment. Most of our patients are folks that their whole lives, their noses never worked. Their whole life, they've just sort of learned to breathe through their mouth because they have to. If anybody has a choice, anybody, any animal really has a choice between breathing through their nose or breathing through the mouth, every single one is going to choose breathing through their nose. The only reason that somebody chooses to breathe through their mouth is because they don't have a choice. The choice has been made for them, and therefore they got to drop the mouth open. And it leads to, I mean, again, I can go on, but cavities and TMJ issues and on down the line of all the maladies that you don't want, that are all attributed back to that mouth breathing.
Yeah, I was looking at some. I'm clearly no expert on the subject, but reading something the other day about how your nose and going through those passageways even humidifies the air, right, for your lungs, and
Mhm.
it's just that's the way it's supposed to go. Like you said, unless you're sprinting, unless you're running for your life, right,
Yep.
and you just need to get air any means possible. Yeah, that is such a fascinating fascinating thought, for people who are just like, yeah, my nose doesn't work that well, whatever.
Right. Yeah, and actually nowadays they're the good news, and I've been really massively pleased to see this. There are books and there's all sorts of things coming out talking about this multiple from multiple angles. Dentists tend to be the biggest champions for the airway that I've seen because they see the side effects. They see what happens when your nose doesn't work, and while they can't fix the nose, they can put the flag up and say this is a problem. And so honestly, I feel like the dental community is so far ahead of the medical community in the understanding of how negatively or positively impacting that mouth breathing issue is, meaning how negatively impacting it is when it's there and how positively impacting when you get rid of it. Especially, I mean, it's certainly there's tons of adults who deal with these issues and they need help. But children who are mouth breathing, even for a part of the day, that's a ticking time bomb. A child who's mouth breathing is going to not form properly. Their airway will become more and more deformed as they're growing. And so a child who is forced to breathe through their mouth is going to create an adult who is going to have airway issues for the rest of their lives, whether that's sleep apnea or snoring or you name it. That kiddo's life is going to be put in a downward direction where what was supposed to be isn't going to be anymore because of that airway. And so those are the kids I sort of feel the most kind of impassioned about just at least getting awareness out that this is a problem, something should be done about it. And there's so many things we can do. I guess I keep coming back to that. There's so many different options nowadays to provide relief and solutions that it's first step there is understanding that there is a problem or that there might be a problem, and then do something about it.
100%. And I think, for someone watching right now who's going, okay, I get it,
Mhm.
hit me over the head with it. I need to get this, looked at. What are some of the fears and concerns people come with? I mean, what I think offhand, right, is my insurance going to cover this? What
Mhm.
does
Mhm.
downtime look
Mhm.
like? Is it going to hurt? Is it going to, am I going to look
Sure.
different or whatever that might be?
Right.
Can you address those?
Yeah, I mean, absolutely. For all the issues that we just talked about, and those are covered by healthcare insurance, and so from an insurance standpoint, it's medically necessary. So that shouldn't be a concern. It is, I think, for a lot of people who are dealing with these issues. The mind naturally wants to go to all the reasons why I shouldn't do something. That's just
Right.
how we work, and
Sure.
so I think cost is a factor. And so I'd say yes, these are things that are covered by healthcare insurance. This is what insurance is for, is to cover these sorts of issues. So that shouldn't be a concern that way. I'd say from a pure I don't like going to the doctor and I don't like having things done. I get it. Although even there, I'd say what we're talking about are procedures similar to having dental work done where we've got to get somebody numbed up. And that's an easy process in the nose, especially is it's easy to get somebody numbed up. It's easy to make profound differences. We're literally talking, minutes of work to have a lifetime of change. So there's really no particular, reason not to there. It's with anything, if you didn't have to do, how do you say it? You'd rather a procedure or no procedure. Well, if I didn't have to do a procedure, I'd rather not. Now, if you're dealing with an issue, I would say doing a low key procedure to get rid of that issue is is where it's at. And I'd say that's what we're talking about. And so, for most of our patients who go through our office-based procedures, it is similar to like going to the dentist, where it's a little weird because you feel like your nose is numb, and then when we're working, there's a little bit of pressure as we're working, but it's very, very low key, and patients are back up and doing their thing right away. So there's sort of a identify the problem, get it rectified, and move on with your life, kind of a thing. And so there's really no particular reason not to do stuff. But again, I understand why, folks will try to think about, well, maybe I won't, maybe I'm not going to because of this, because of that. I'd say, honestly, the thing that I think the common chorus from our patients is wishing to have done something sooner, because there's only one life. Obviously, we have one life to live, and every day that goes by that's either optimal or suboptimal never comes back again. And so I think if you're dealing with issues, it's sort of on you to realize the importance of your life and the importance of breathing and do something about it. And then the nice thing is the sooner that you take action, the more, dividend gets paid out, because every day on the back end is something that you now have something that you didn't have before. So it's sort of a lot of reasons to do something, not a whole lot of really, there's no particular good reason not to, other than just not knowing some of these simple truths.
Absolutely. Yeah, no, I think that's a really good point. And I don't want to leave you before we at least address, again, the pandemic with coronavirus, right? People thinking like, okay, maybe I'll deal with this next year because I don't want to, I wouldn't go to the dentist right now. I don't want to go to an ENT right now. Can you just speak to that?
Sure, absolutely. I mean, we've had to, sort of change our practices to accommodate the coronavirus. So we've done that. We've done that, sort of soundly, safely, following, all the guidelines. And the truth is, it's sort of this weird flipped around reality that I'm currently living is that people have, I think, taken the time away from, or the time out in life that we're all going through now with coronavirus. A lot of folks have taken that time out and said, hey, I'm going to reprioritize my life. And for almost, I'd say everybody, I was going to say almost, who doesn't put health at the top of that list? And I think right also at the top of that list is family. Health and family are the two things that are the most important things in life. And I'd say what we're seeing is a lot of folks who had excuses about being too busy, to this, to that other, or, the other thing, are finding the time and taking the time in the midst of this pandemic to come in to seek treatment because they have a little bit more time in their life right now. And so we can see people safely, we can do procedures safely. It's almost like the not that there's any particular thing, anything good about this pandemic, but I'd say some folks have found benefit in this pandemic or through this pandemic to do the things that they should have done maybe before. Back to what I was saying before, life is short, and I think this has taught us that, sort of right in front of our face, like, hey, the clock is ticking here, and there's, sort of always a good reason to make an excuse, but sometimes it's like, okay, enough is enough. But yeah, we can do what we do very, very safely, and that's a good thing. And I think that people should take comfort in that knowledge as well.
Absolutely. Well, Dr. Kandula, I really appreciate it today. I think this has been super informative. It's been good to hear a little bit of your story and history with this, how you were affected personally with, ear, nose, and throat issues, and how you developed a passion for that. And again, to have 10 locations now and to serve the community like you guys have for so long, we definitely applaud you guys. We hope you guys keep up the good work, stay safe, and I'm sure we'll be talking again.
Perfect. Thank you. I appreciate it. This was fun.
Absolutely. I agree. Take care.
Take care.